Nerve fibers types and their function. The nerve fibers classified based on Erlanger and Gasser classification. They have been divided into A, B, and C groups, and A group is further divided into A alpha, beta, gamma, and delta fibers. There is also numerical classification which is used for classification of sensory neurons, which is based on their origin of nerve fibers. There is also physioclinical classification. It has which has a clinical as well as physiological significance and is based on the sensitivity to hypoxia, pressure, and anesthetic agents. So this table shows the Erlanger-Gasser classification. You can see they've been divided into A, B, and C fibers. A further divided into A alpha, beta, gamma, and delta, where the classification is mainly based on the diameter of the nerve fibers and velocity of conduction. The diameter gradually decreases as from A alpha to C fibers, and the velocity of conduction is also going to decrease as they come from A alpha to C fibers. A alpha, they are proprioceptors and somatic motor. A beta, they carries touch, pressure. They are also motor fibers. A gamma is a motor to the muscle spindles. A delta carries pain, cold, touch sensation. Beta are the preganglionic fibers of ANS. C fibers, they are the they carry pain, temperature, and some mechanoreception and reflex responses, whereas C fibers, they are postganglionic sympathetic fibers. The numerical classification is on the origin, where 1A fibers, they originate from muscle spindle, that is annulospiral endings. 1B from Golgi tendon organs. 2 fibers from muscle spindle, that is the flower spray endings, touch and pressure sensors. 3 is they originate from the receptors of pain and temperature, and some from touch and pressure receptors as well as 4 from the pain and other receptors. There is a physioclinical classification where they are classified based on the sensitivity to hypoxia, pressure, and the local anesthesia. The B fibers, they are more susceptible for hypoxia, and the C fibers, they are least susceptible for hypoxia, whereas the A fibers, they are most susceptible for pressure. C fibers, they are most sensitive for the local anesthetics.